Good day. In this investigation, we look at dengue in a Caribbean population. This research study looked at syndromic surveillance markers and their use in the diagnosis or early diagnosis of dengue in patients, particularly in the island of St. Lucia. The investigation revealed that symptoms such as undifferentiated fever, acute respiratory infections, or fever of respiratory signs, and gastroenteritis, 3 out of 5 syndromic markers were found to be significantly associated with dengue in the St. Lucian context. Dengue is one of the world's most important vector-borne viral diseases. And every year it impacts millions of persons around the world. Though we acknowledge that the mortality rates may be lower than other diseases, but it does have a significant morbidity rate. And for countries such as St. Lucia, which rely heavily on tourism, any disease that can dissuade visitors from coming to the island means a significant impact to the economic realities on the island. Now, there's very little published data available on dengue, specifically in St. Lucia. Though the disease is widely researched, one of the things we've recognized is that the epidemiology of the disease differs across populations as well as geographic locations. In a country such as St. Lucia, a small island developing state, where there is no national healthcare insurance, and most persons have to pay for healthcare out of their own pockets, preventive medicine is important. And the earlier we can diagnose patients with dengue, then the earlier we can treat, manage, and reduce the impact of dengue on the individual as well as the wider population and society. Now, the Ministry of Health, Wellness and the Elderly already maintains a syndromic surveillance database that they collect data regularly, and that data is available for analysis. The study was done accessing this data from the syndromic database from St. Lucia and looking at data from 2009 to 2017, and all complete records were included within that period. That data was subjected to statistical analysis, and the results indicated that undifferentiated fever, acute respiratory infections, or fever with respiratory signs, as well as gastroenteritis, were associated significantly with dengue. Now, why is that important? The Ministry of Health publishes a National Communicable Disease Manual, which provides guidance to physicians looking at syndromic clinical signs and the possible infections associated with those syndromes. And for fever with respiratory signs, as well as gastroenteritis, these were not included within that Communicable Disease Manual. And the results of this research can be used to suggest that maybe this needs to be revisited. The earlier we can diagnose any infectious disease, but in particular dengue in this case, then the earlier it is that we can manage the disease and provide hopefully better outcomes to the patient. In St. Lucia, which as an island relies heavily on its human resource, anytime persons are sick and away from work or away from school, you end up with a loss of productivity. So by that early detection of a disease such as dengue, which is very prevalent in the islands, prior to the COVID-19 outbreak, epidemic, or pandemic really, the Caribbean was experiencing the worst ever, or at least in recent history, the worst epidemic of dengue. So it shows you how important the disease continues to be within the region. So therefore, anything we can do that can assist physicians in the earlier diagnosis and management of these cases, then the better it is for both the individual patient as well as the wider population. The results also can be used to suggest that there is a greater need for analysis of locally available data, which may provide greater insight to the epidemiology of various diseases, not only dengue, but various diseases that may differ within the local context. So by using data which is local centric, it allows the health authorities to make better decisions which are really and more truly focused on the population at risk. So hopefully further investigations will be conducted on the basis of this research. Thank you very much.